Welcome back to Healthy Steps, where we provide unique personalized care by measuring VO2 max and anaerobic threshold. There are two terms we need to define first, AT and VO2. Anaerobic threshold is an important determinant of endurance, but it is not endurance. It helps to predict and improve endurance in athletes and patients who do the exercise test. VO2 max measures how efficiently you use oxygen. It is your body's maximal capacity to uptake, transport, and deliver oxygen during intense exercise. The higher the VO2 max, the lower the risk of death and disability from all illnesses. Two questions before we begin. Is oxygen important?
For sure, without oxygen, there is no life.
Is efficient use of oxygen important?
Absolutely. If my body can't efficiently use oxygen, I don't have optimal emotional, physical, or intellectual health.
So, how are we helping you increase your AT and VO2 max? Well, those numbers are a function of three things: oxygen uptake, transport, and delivery. This video focuses on oxygen uptake in relation to VO2 max. Oxygen uptake is how well your body is taking in oxygen. The more oxygen, the better. Think about it. If you have congestion, how optimal is your physical, emotional, and intellectual health? Even if we don't feel sick, such as coughing, sneezing, itchy eyes, we can still have chronic airway inflammation, which stops us from getting the oxygen we need to feel healthy. Symptoms of chronic airway inflammation can be fatigue, weight gain, irritability, depression, difficulty focusing, chronic headaches, migraines. If chronic inflammation affects the eustachian tube, cochlea, or semicircular canals, it may lead to decreased hearing due to inflammation around the cochlea, the hearing center, and/or imbalance due to inflammation around the semicircular canals, the balance center. If treated early, this can potentially delay hearing and balance problems as we grow older. It can even cause increased risk of hypertension, heart attack, and stroke because less efficient oxygen absorption means the heart must work harder. In the clinic, by doing a physical exam, we can tell if you are experiencing chronic inflammation, which can be caused by allergies to pollen, dust, trees, mold, pollution, perfumes, and food. We can treat airway inflammation with allergy medications with the goal of decreasing congestion, because it's easier for oxygen to go through thin walls of mucosa versus thicker walls. The less congestion, the more oxygen your body gets. Looking at the you treated versus you untreated, who would lose a race? Have unusual fatigue, have depression or anxiety, struggle with weight gain, be more likely to have decreased hearing, be irritated more often, have increased risk of hypertension, stroke, and heart attack? The answer is the untreated you. Treatment to improve your oxygen uptake depends on the causes of airway inflammation. Food and respiratory allergens can be checked through blood or skin testing. Oftentimes, we find patients with emotional, physical, or intellectual challenges have reactivity to allergens but don't have the acute symptoms of sneezing, itchy eyes, runny, stuffy nose, cough, etc. Thus, these tests allow us to find chronic causes of inflammation, target them, and optimize oxygen absorption uptake to improve health holistically. If allergens are the culprit, we will treat with a daily allergy medication. If you are sounding or feeling congested, we will add guaifenesin and nasal spray and other medications depending on how your body reacts. If you have significant allergens and symptoms, we also recommend under the tongue or injection immunotherapy for optimal success. Teamwork with healthy steps to achieve your best emotional, physical, and intellectual self by letting us fine-tune your uptake, transport, and delivery of oxygen. We want optimal oxygen absorption, so controlling airway inflammation is critical.